RCH phase 1. So first one is the provision of essential emergency care to the mother and to the children. They try to provide essential and emergency care. Okay, next the provision of equipment and drug kit to the selected PHC and first referral unit. So when you went to Sonapur hospital, I think you have seen there are different drug kit. For example, drug kit for prevention of STD, drug kit for prevention of HIV. So the drug kits are of different color. I think you must have seen in Sonapur hospital. So they try to provide, means they try to improve the infrastructure, and they also try to improve the manpower of the selected PHC and FRU, so that they can provide effective care to the mother and the children. Then provision of additional A&M staff, nurses, laboratory technician for the selected districts. So it means they wanted to improve the manpower facilities, the human resources. Then the provision for 24 hours delivery. Before it was not there. Nowadays in subcenter also these facilities will be there very soon. The government, they are planning to provide 24-hour delivery facility even in the subcenter. Before, these facilities were available only in the district hospital, then special hospitals, but in the RCS program, they tried to provide 24-hour delivery services in the PHC and the selected FRU. Then referral transportation in case of obstetrical complication. They wanted to improve the referral transportation services, immunization and oral rehydration therapy, ORS, distribution of ORS and immunization. Everyone have idea regarding immunization. Then here is some drawback of the RCH phase 1. Due to this drawback, they have come up with the RCH phase 2. So let's discuss what are the drawbacks of RCH phase 1. So, first drawback was the outreach services were not available to the vulnerable and needy population. The outreach services were not enough during the RCH phase 1. They have only provided the healthcare in the institution. The outreach programs were not adapted in the RCH phase 1. Next one is the management of financial resources were inadequate. Whatever financial resources they were getting from the government, it was not adequate. Means financial support was not adequate. Then the human resources, for example, doctors, nurses, health workers were deficient. Means human resources were not they were not fully satisfied with the human resources. It was not adequate according to the need. Then the management information and evaluation system was lacking. See, until and unless you evaluate something, you will not know the drawback of the particular programs, particular service. So the evaluation system always should be very effective, so that if you evaluate something, then only you will know where you are lacking behind. But in RCH phase 1, what was the problem? The evaluating system was not effective. The management system was not effective. Because the management system was not effective, so the evaluation was not effective. Okay, then the effective network for first referral unit was lacking. The referral services were not up to the mark. Then quality services in PHC and CHC were very poor. Maybe it was not fully developed. Okay, before, the quality services of PHC and CHCs were really very poor. Okay, I already told you that even 24-hour delivery services were not available in PHC and CHCs. After this RCS program, they tried to give the 24-hour delivery services in the PHC or in the CHC. Now slowly they also tried to provide these 24-hour delivery facilities in the sub-center also. Because these facilities were not available, that's why IMR was very high, because home delivery were very high in number because of the less facility. But nowadays it increasing, that's why this IMR and MMR is slightly reducing. Then lack of community participation. Maybe due to lack of awareness, the community participation also were not adequate. Then due to those drawback, this RCS phase 2 it came into existence. Okay, due to those drawbacks, this RCS phase 2 they have came up with the new facilities, new objective, new aims to achieve their aims. Okay, now let's discuss what is RCS phase 2. So it was started in 1st April 2005 up to 2009. In the 5-year plan, they have introduced this RCS phase 2. This RCS 2 version articulates improving access, use of quality RCS services, especially for the poor and unserved population. So this was the main aim of RCS phase 2. Aim of RCS 2: to reduce the infant mortality rate, maternal mortality rate, total fertility rate, and to increase the population protection rate, immunization coverage, especially in the rural areas. This was the main aim, to reduce the infant mortality rate, maternal mortality rate, total fertility rate, and to increase the couple protection rate and immunization coverage rate, especially in the rural areas. Then come to the objectives of RCS phase 2: to improve the management performance, because in RCS phase 1 the management performance were very inadequate, it was not adequate. So here they want to improve the management performance, to develop human resource intensively, because it was lacking behind in phase 1, so they tried to improve the human resource here. Then to expand the RCS service area. Before they were providing the essential and emergency care, now they are providing the referral care also, so they are increasing their area of care. Then to monitor and evaluate the services, because in phase 1 it was not there, so in phase 2 they have adapted. Then to improve the quality, coverage, and effectiveness of the existing family welfare services and essential RCS services, with a special focus on the above mentioned EAZ states. So here they try to improve everything where they are lacking behind in the phase 1. They wanted to improve the quality and coverage of the effectiveness of the existing family welfare services, whatever is already existing. They want to adapt there. They want to improve the infrastructure. They want to improve the human resource. They want to provide more care. Means they want to provide quality care